Now we are going first for ARDS, okay, because those slides which you have learned now, the same slides only I am going to discuss you. ARDS stands for Adult Respiratory Distress Syndrome. This adult respiratory distress syndrome mostly is a clinical terminology. The clinician only they can able to pick it up this diagnosis. Why and how we will discuss. First we will go for a definition, etiology, pathogenesis, morphology, then clinical features. Definition is adult respiratory distress or else acute respiratory distress syndrome is a clinical syndrome caused by diffuse alveolar and epithelial damage. Till now we discussed only about either alveoli or else capillary. Only this disease which affects both capillary and the epithelium. Epithelium is nothing but the epithelial lining of the alveoli. We have type 2 pneumocytes and type 1 pneumocytes. Onset is a life-threatening respiratory insufficiency. It can cause cyanosis, severe arterial hypoxemia that is refractory to oxygen therapy and may progress to multi-system organ failure. The patient who are been diagnosed with adult respiratory syndrome, even though you give oxygen therapy, but still they will go for and progress to multi-system organ failure. That much it is severe. Okay? Yes, yes. Yeah. The histological manifestation of ARDS in the lungs is known as diffuse alveolar damage. Okay? This could be a possibly MCQ. Histologically it presents as alveolar damage, diffuse, all alveoli it get damage. Respiratory distress syndrome of the newborn, pathogenesis is distinct and it is caused by primary deficiency of surfactant. Adult respiratory, I keep on saying you adult respiratory distress syndrome adult, but it can occur in young children, newborn. We will call it is more here in newborn it's due to very good surfactant, whereas in adult it's due to these features. Either it can be due to pneumonia, aspiration from the gastric contents going to the lung, pulmonary injury, a contusion, hitting of the iron rod, any accident, fat embolism, drowning, swimming and drowning, right? Near drowning, inhalation injury, reperfusion injury. These are all the indirect causes like sepsis, severe trauma, cardiopulmonary bypass, acute pancreatitis, drug overdose, transfusion of blood products and uremia. How it causes? This is the alveoli. Okay, one alveoli. This is the blood vessel. What happens? This is the normal alveolus. Normal alveolus will have a bronchial epithelium, type 1 pneumocyte, type 2 pneumocyte, macrophage. This is the normal process. Whereas here in injury, as I said it before, previous slide I showed you many causes. In that you consider one of the causes. Okay, any sepsis or pneumonia or due to trauma, what happens? The neutrophils which will enter into the alveoli due to trauma. For example, there is a trauma, neutrophils will enter into the alveoli normally. When it's entering into the alveoli, numerous amounts of neutrophils will enter because of the injury. These neutrophils having the property of releasing platelet activating factor, leukotrienes and proteases. These three are toxic to the alveoli. This affects the alveoli epithelial cells. It causes necrosis. Yes, it undergoes cellular debris. Then finally the macrophage which is present over there in the alveoli, which will also recruit more amount of neutrophils, because the property of the macrophage is it's like that. Whenever there is an infection, a pathogen, it will recruit. So this is a cycle. Macrophage is recruiting with the help of tumor necrosing factor, interleukin 8. These neutrophils entering inside, it releases these three factors affecting this. Thereby, it is totally affecting the entire alveoli. That's why we call it as diffuse alveolar damage. X-ray, it presents as like this, full of air. There is no, what happens? There will be full of air should be there. Because of this damage, there will be full of fluid, and you will be seeing presence of this kind of feature, X-ray feature. Necrosis, total necrosis. This is the last practical session I showed you. Lungs are heavy, dark red, firm and heavy because of the fluid collection. Alveolar walls, this is the alveolar walls lined by waxy hyaline membrane. You can see here inside, because of the damage you will see fluid, edema fluid. Now once there is an, as I said, there is an injury, there will be congestion. Those congestion only you are seeing here. This is alveoli, these are all the capillaries. you are seeing here interstitial alveolar edema and hemorrhage. After some stage, those edema and hemorrhage, after some stage what happens? It undergoes necrosis. Okay, it undergoes necrosis. What is this? Necrosis of alveolar epithelials. This is how it undergoes, step by step. Now, after some stage, the patient should get treated. It should be healed, because otherwise he will get collapse. He will be dead. So, if he is getting in a treatment process, that stage is known as organization stage, organizing. So, organizing stage, you can see a vigorous proliferation of type 2 pneumocytes. Okay, to bring back the alveoli normal, to function it normal. So, there will be vigorous proliferation of type 2 pneumocytes. There will be marked thickening of alveolar septa caused by proliferation of interstitial cells and deposition of collagen. This stage, you will see these two features. Exactly, to make it normal, to function it normal. So, that is why it is making that there will be an alveolar septa, thickening of the alveolar septa, because it is damaged. So, it want to make thickening and it want to protect. Exactly. Now, the clinical features are, depends upon the prognosis, depends upon if it is advanced age, 60 plus, very poor prognosis. Bacteremia, if it is infected with the bacteria, very poor. If going multi-system failure, again. Acute stages, you will see diffuse interstitial fibrosis may occur with the continued compromise of respiratory function. In the sense, in acute stage, there will be an diffuse fibrosis will occur with some kind of a compromise. With some if there is an injury here, those area will undergo compromise and remaining area will try to function. That is all about this acute respiratory disease. This is the summary. It is almost each and every points are there in your. Yeah.
When you finish this, just give me an answer.